Welcome to the Happy Bones, Happy Life podcast. I'm Margie Bissinger, a physical therapist and integrative health coach, and I am your host and guide on our journey to discover the keys to stronger bones, more happiness, and the secrets to live your best life ever. From nutrition to stress, from exercise to happiness, you will gain revolutionary insights from our leading experts. It is time for you to discover the health and happiness you deserve. Hey, Margie here. We're headed into the holiday season, and one word that comes to all of our minds is hope. And today we're going to focus on the extraordinary power of hope. Our special guest is someone that I've heard speak on this topic, and his message is so powerful, and I'm really excited to share it with all of you. So our special guest today is Dr. Mark Pochapin, and he's the Sholtz-Leeds Professor of Gastroenterology, the Director of the Division of Gastroenterology and Hepatology, and Vice Chair of Clinical Affairs in the Department of Medicine at NYU School of Medicine, NYU Langone Health. In his clinical and research efforts, Dr. Pochapin is dedicated to the prevention, early detection, and treatment of gastrointestinal cancers, and to quality and endoscopy. As an educator, Dr. Pochapin has received over 30 teaching awards, including the Humanism in Medicine Award. Over the past 20 years, Dr. Pochapin has been a leader in the national effort to increase colorectal cancer screening and promote quality in colonoscopy. Dr. Pochapin currently hosts a bi-weekly national radio broadcast called Chiefs Rounds on Sirius XM Doctor Radio, connecting the listening public with leading medical experts and valuable health information. Dr. Pochapin is currently the president of the American College of Gastroenterology. Wow, he has such impressive credentials, but the best part about our speaker today is that he is my little brother and an amazing person. So in today's interview, and I'm gonna call him Mark, Mark shares what he has witnessed as a physician and the true power of hope. He also provides life lessons that can really impact every area of your life in a positive way. So stay tuned. Welcome, Mark. I am so excited to have you here on the podcast. Besides being my little brother, you are such a special person, and you've just given so much to the medical community, but also to every single person that you touch. And so I'm just really thrilled to have you here and talking about your message of hope, because we just finished Thanksgiving, the holidays are coming up, and it's really a time when so many of us really just need to hear this message. So thank you for being here, and I'm just so thrilled for this interview.
Well, I'm so honored to be part of your podcast. I mean, this is incredible. I can't get over how professional this is, and so excited to be part of it. Because as you know, when we do our gratefuls over Thanksgiving, we all go around the table and talk about what we're grateful for. And one of the things I'm grateful for is that I have a family that not only supports me in what I do, but also promotes a lot of the same ideas that I promote professionally. And I know how much you believe in this idea of hope and how critical it is that as physicians, we not only give hope, but we never take it away. And that's something I found in my job that has been so rewarding, but also so difficult, because not all physicians understand that, not on purpose, but sometimes not meaning to actually create a problem, they actually create a problem when they take hope away from patients.
So let's start, first of all, why? Like, why have you found that hope is such a vital ingredient and that really is needed for everyone that you as a physician deal with?
Well, I think that hope is probably the most important factor that gets people through a difficult time period. I mean, hope has been the main driving force among all great things that have been achieved, not only just in terms of what we've done in medicine, but in all aspects. I mean, think about people coming to this country, hoping for a better life, hoping for a better future for their kids. It's always about what can be, and by hoping for a better future, they're able to sustain a difficult present. And that is so true in medicine, that if we take away hope, we take away any reason to live, to move forward, to get through a difficult time, to get through a difficult treatment. And it doesn't have to be false hope. I'm not talking about false hope. There's plenty to hope for in modern medicine. We just have to make sure we give it in the appropriate form and the appropriate dose.
And so often I hear people come into me and I'll see them and they say, you know, the doctor just said there's no hope. And you can see their face is drained. They are so unhappy. But why do you think that? Why do you think inadvertently medical professionals take away people's hope sometimes?
Because I think sometimes this concept of being honest, being truthful, giving the patients all the information somehow takes on this construct that in medicine we look at statistics and we look at outcomes. But a patient is not a statistic. They're either all or none. They either respond or they don't. But when you give them a statistic, especially when the statistics are very difficult, it feels very much from the medical professionals world, like by being honest, you have to tell them that, well, statistically, it doesn't look like this is going to work. And once you put that into someone's mind that it's not going to work, it's not. If you tell someone that they're going to have 6 months to live, it's like doing a term paper. When you are told that you have 6 months to do a term paper, it's going to take you 6 months to do it. If you really put in someone's mind that they have 6 months to live, I honestly believe their whole body sets its frame to that time period. And you don't know. The truth is that we never know how long someone has to live. And I've seen people with terrible diagnoses of pancreatic cancer. That's one of the areas that I am actually first to give a diagnosis in. And I have seen patients being told they have 2 months to live, 6 months to live, and they've lived 2 years or 3 years. You just don't know. Of course, sometimes they do live only 2 or 3 months. But because we don't know, why do we assume the worst? Why not instead assume the best and then try and modify what we're hoping for as we go forward? For example, first you get a diagnosis of something terrible. You hope for a cure. And there are cures, even for pancreatic cancer, found early enough. I've had patients cured for that. But if not, or if it's widely spread, then you hope for a new treatment or a new cure. And there are new treatments and cures coming out all the time for different diseases. In cancer, it's more difficult to find a cure, but something that might prolong their life for the next innovation, the next new treatment. And then if someone is really not responding, then there's hope for comfort. And at the end of the life, there's hope for peace. But there are things that we can hope for, Margie. We can never take that away as medical professionals. I think that's really the main message that I try and impart on my trainees and on my colleagues.
And I love that, because that's so true. Our thoughts are so incredibly powerful. And if that's what we're focusing on limitation, and that we, what we don't have, and we just are going to have a few months to live, that is what's going to happen, because, the thoughts control us. So
the mind is so powerful, and I don't think we fully tapped into it. I think our medicine is really focused on the treatments and the therapies and the medicines, but we are beginning to look at mindfulness and gratitude, and the mindset you put yourself in prepares you to receive the treatment. And I do think that's really important. I don't think it's all or nothing, and a lot of people get too carried away with one or the other, but they have to work together. I think when we look at some of these more complementary treatments, we have to use them recognizing that they will enhance what we already have, with the hope that there'll be something better down the road. But William Osler, who is the father of modern medicine, used to say that when the patient's sick, the whole family has the disease, that everyone is sick. And you see the beauty of human giving and of caring, that you have friends and family and spouses who are there with a patient at a time of their greatest need. And the love and the caring, without a doubt, makes the patient better, helps them get through the difficult time. And one of my mentors, Larry Brandt, used to say sometimes holding a patient's hand is often more important than examining it, because sometimes we just need to be present. And there is something very therapeutic, something medicinal about being present, about being caring, and about allowing a patient to really believe that they can get through this. Now, if they can't, then there are other things that we have them hope for. As I mentioned, sometimes it's the hope for comfort. And we have to recognize that in medicine, that we all have a finite life period. As one of my patients, a 90-some-year-old woman, once said to me, the greatest risk of dying is living. So you may as well live. And the truth is that death is a part of life, and that unfortunately we have to accept that. And so when someone is really at the end of their life, when what we're doing is no longer prolonging their life, but instead prolonging their death, we have to recognize that we can do something about that as well. We can make people comfortable. Talking about palliation or comfort care is not terrible. It's not doing nothing. It's not giving up. It's actually giving patients something at the end of their life so they can die peaceful and with dignity. So there is always hope. Of course, we always want patients to live and to get well and a new treatment. But even at the end of the life, there's hope for peace and comfort.
I love that. Well, you know what, though? You have some really great stories about people living when people were told there was no hope. So why don't you share one or two of those stories? Because I think they are so inspiring, and it really proves the message that you're trying to share with all of us.
So I'm glad none of the kids are around, because they've heard these stories 1,000 times. So I'm glad I get to tell it now. Well, what's amazing in medicine in my career has been that I've seen the development of certain diseases, and I've actually seen the eradication of certain diseases. So for example, a quick one is hepatitis C. Now, when I was in my training as a gastroenterologist, there was hepatitis A and hepatitis B. Then a new hepatitis was noticed. We didn't have a name for it. So it wasn't A and it wasn't B. It was called non-A, non-B hepatitis. And it caused elevation of liver chemistries, cirrhosis, and sometimes death for patients. But we didn't even know what it was. Well, in my career, not only have we defined it as hepatitis C, but we now have a treatment and actually a cure that's over 95% effective. It just eradicates it with oral medication. That was unheard of. We used to give people horribly toxic medications intravenously, like interferon, that would make them so sick with only a 10% response. Now they get hepatitis C, we just give them pills, and by and large, they're going to be cured. In fact, we can even transplant organs with hepatitis C virus and then eradicate the hepatitis C in the recipient after they receive the transplant. So there's a disease that we didn't even have a name for. Not only did we have a treatment, but now a cure. Now, the AIDS world is another incredible story, which I've seen from the beginning, because when I started doing my training as a resident, particularly in New York City was ground zero for HIV and AIDS, and those patients were so sick, and it felt so hopeless. And I remember even when I was taking care of those patients, rounding on the wards, you almost can't get to the next one because it was so difficult, because there was so little we could do. And there was actually a little article on the wall from Ann Landers. I don't know how many of our listeners know who Ann Landers is, but this was a column of advice. And it said, "Dear Ann Landers, please repeat the story of the starfish." And I think many people know this story, where the little girl is throwing in starfish on a beach when hundreds of thousands of them washed up on a storm. And an old man says, "Why are you throwing this starfish in? What possible difference does it make? The whole beach is filled with starfish." And she picks up the starfish and says, "It makes a difference to this one," and throws it back in. And it got me through, Margie, recognizing that we can make a difference for each individual person. And I held that same concept when I became my own, in my own practice as a gastroenterologist. And I occasionally would need to put in tubes to help people with their nutritional needs, particularly through the end of their life, or if there's a new trial. And so that's what happened. There was a new trial on a drug called Crixivan. And the infectious disease doctor sent me the patient, asked me to put a feeding tube in. And I look at the patient. The patient was a human skeleton. He was so sick, so malnourished, and literally at the end of his life. In fact, I wasn't even sure that he would survive the actual procedure of putting the feeding tube in. And I spoke to the doctor and I said, I don't know if this patient will make it. And he says, "Well, the patient won't make it regardless. And this new drug is something we're excited about." So I put the feeding tube in, and the patient survived the procedure, and off he went and started getting some nutrition while he got this new medication. I didn't hear anything for about 3 months. And I really thought that I would hear that this patient had passed away from his AIDS. And I get a call from the infectious disease doctor, and he says, "Mark, I need you to take the feeding tube out." I'm saying to him, "Well, which patient are you referring to?" He said, "The patient I sent you who went on the new trial." I said, "He's still alive? He's okay?" Because not only is he alive, you're not even going to recognize him. Just wait till he walks in. And in walks this incredibly handsome man. He put on 30, 40, 50 pounds just over those few months. And he looked well, Margie. It was a miracle. And I took the feeding tube out, and I remember he had tears in his eyes. I had tears in my eyes. And I witnessed the miracle of modern medicine. And the next time I saw this man was 10 years later for a screening colonoscopy to prevent colon cancer. And the next time I saw him was 10 years after that for his next screening colonoscopy. And now AIDS, although we can't cure it, is not the death sentence it was. It's not the horror that I witnessed as a resident. And that's a miracle. And when people say, well, why can't we cure cancer? We do cure some cancers. There are children we cure, and there are cancers that we do much better. We're using immunotherapy, checkpoint inhibitors, all this new technology and innovation. We are doing better, and people just can't give up hope because you don't know what's around the corner. And to see AIDS, which we all know is such a death sentence, become just a chronic viral illness, and we will wipe that out too. We'll figure out a cure to HIV. But for now, patients are living normal, healthy lives.
That's great. And there's one more story. I just love the story. I think you know the one I'm thinking of, the wedding.
Oh, yeah. Well, that's about pancreatic cancer. And this is a story about why we have to understand the patients, no matter what age they are. So a patient of mine, Renee Dorwick, who at the time was in her 80s, had come to me because incidentally, there was a mass on the pancreas found when she was having a scan of the kidneys. And she wasn't sick, she felt well. And although she was in her early 80s, this was a spunky lady. She was very involved with politics and her local community, and everyone knew her. But this was not a woman who was ready to die. And she starts off by saying to me, I know pancreatic cancer is a death sentence. If you diagnose pancreatic cancer, I don't want any therapy. So why should we even bother with the diagnosis? And with her was her family. And her daughter, Bonnie Krensman, is someone who is a real outspoken advocate now for pancreatic cancer. Because I spoke to Renee separately, and I actually asked Bonnie to step out. And I said, tell me what you really want. Look, I don't know that we can cure you, but if we make a diagnosis, this is found incidentally, meaning by accident. If anything, it could be very early. If we're ever going to cure someone, you're the type of patient we can cure. It is a possibility. I'm not saying we're going to do that. But if you're someone who looks to live for something, then let's think about this. Let's think about this together and make a decision. And if you tell me at the end of our conversation you don't want anything else done, then you're the boss. So she says, okay, I want to see my grandson married. I said, okay, that's something very important. I said, when's the wedding? She said, he's not even engaged yet. I said, okay, and it looks like you need to have some time, and I don't know I can get you there, but let's at least figure out whether this is cancer or not and look at the options. So I do a procedure called endoscopic ultrasound where we look from a probe on an endoscope in the stomach, and I biopsy, and sure enough, it is cancer. We sit down with the whole family and make a decision that she does want to have the surgery to remove it. So she has the surgery to remove it. She gets chemotherapy and I believe even a little radiotherapy, and did really well, did well with the surgery. She was a healthy woman. And sometimes, even though patients are in their 80s, they do really well with the treatment. She did well with the surgery. She did well with all the medical therapy. And when we did our follow-up scan 6 months and a year later, there was no evidence of any recurrence. Anyway, within a few years, her grandson gets engaged and gets married. And as far as we can tell, a few years out, she is still cancer-free and living life, really living life. So I get an invitation to the wedding, and I go to the wedding. And there is a picture of me dancing with her that was taken by Bonnie that is so beautiful, because I remember years before she said this is what she wanted before her grandson was even engaged. And this was the life moment that she lived for. And no one can guarantee that. I made it very clear. I can't guarantee she'll be there. But she got there. And I think part of it was because of her strong will and because there was really a chance that she could make it through. So why take that away from her? And I use that now when I talk about hope. Now, of course, it has to be clear that some people have terrible outcomes, but why start off with that mindset? In Reni's case, she actually never died of pancreatic cancer. She died years later of a different disorder. She had actually beaten pancreatic cancer, and it doesn't happen often, but sometimes when we catch it early, it does. And now, as I mentioned, her whole family are all advocates for cancer prevention, cancer treatment, and they're very involved with PanCAN, with the Pancreatic Cancer Action Network. They speak publicly, and that's why I feel so comfortable talking about this story, because I know they talk about it all the time, how important it is. And Rini still lives on and helps many of other people, recognizing that there's always hope.
I love that story. And I love the fact that it could have been different. It could have been, look, you know, why even bother? You're going to die. This is a death. So there's just a total different approach it could have taken. But instead, it took hope. You know, you gave the person hope, and she had hope. And I think, you know, as I said before, our thoughts are so powerful. And what we focus on, you know, is what our reality is. So when we focus on the positive and we put our attention on that, we're manifesting that, versus if we can do it the opposite way. So just such a big advocate. And I think it's so important that we always focus on what the person can do and what can be done instead of the limitations. And even when it's not when it's not cancer, when it's more of a chronic illness or something, you know, you deal with Crohn's, colitis, and I deal with osteoporosis, different things that people all of a sudden conjure up images in their mind that are so negative, and there can be so much doom and gloom in terms of their future. And so I think the message here is, look at the positive. What good exists? What can you do? And what are the treatments? Instead of focusing on the problems and the limitations, to adjust that and focus on what are solutions and where can you focus so that you can start, you know, being part of the solution. And
that's why it's important to get such a great team, why the doctor-patient relationship is critical. And if you don't feel like you have the relationship with your physician or your nurse practitioner or your healthcare worker, then you need to get another opinion, because if there's someone who is not allowing you to have the hope for something else, then sometimes going to an academic medical center where there are clinical trials. I mean, people should not be afraid of clinical trials. Remember, I mentioned that AIDS patient who basically was given his life back because of a new drug on a clinical trial. Sometimes the clinical trial is the drug that really is the miracle intervention or the new way of looking at a disease. Patients aren't guinea pigs. They're being utilized to try and treat their disease, but also in a way that we learn. So is this something that is useful not only for the patient, but for everybody? It's a way of giving back. And sometimes in doing so, you actually might be able to get something that's truly extraordinary that you never had access to before. So it's a relationship with your healthcare providers. It's a relationship with your family, but it's everybody getting together, being hopeful. But again, making sure that the hope is not an unrealistic hope. So for example, if the patient I described to you started getting sick or had a recurrence, I've had patients obviously who've had recurrence, then we start to talk about, well, what does the future look like? What are the options? Now, Margie, I know this is a tough topic for us to discuss, but look, our own mother had ovarian cancer, and how horrible was that? She was at one of the finest places in the world for cancer care. And what was she told? She said, I'm sorry, I was sitting right there. And I know, were you with me?
Yes. Oh, I was there. At that very moment, she was told, I'm sorry, there's nothing we can do. And literally no hope, no anything, no alternative treatment, which there were things, but it was like, that's it. When you didn't fit the clinical trial, there was nothing we could do.
It was like, see ya, you're not good for any trials anymore. You know, we don't want anything to do with you, and took away all hope. And that was one of the worst feelings I've ever felt. Really.
It was so awful. And, you know, she wasn't ready to hear that. And regardless, that wasn't the right message.
Not only that, she wasn't sick. Remember, she was really well. That's the crazy thing with ovarian cancer. It could be very widespread, but they don't get that cancer cachexia, that thinness, that ill appearance. She looked pretty well. And she wasn't ready to die at the time. Then we brought her to another physician who said, there's plenty we can do for you. And then at the end of her life, she ended up in hospice. And I remember Dr. Brescia telling her, Sandy, we're going to restore you, and at least gave her dignity back to her life where we all could be with her. it was pretty awful. But to be in the recipient, be on the other side of the white coat and be heard that there's nothing more we can do for you, because there's always something we can do for a patient. No one should ever hear those words.
Oh, that's the worst. So if you have a family member, it maybe does not be that you're dealing with something, but if you have a family member and they're said, and they hear that, then go elsewhere, find a new team, because there's certainly, that's just the worst position to be in. And there's just nothing to be gained from that whatsoever. And I see miracles every day. Again, it may not be with cancer, but people who find out with their bones, or they find out they have some other issue. And sometimes it's as simple. Sometimes it's just looking at your life. It gives you a time to reevaluate and just look at all your life habits. And as you know, so many people are so very stressed and running, and really not taking care of themselves. And so when they have that time and they see they have something that's happened, with their health, it gives them that moment to sort of reevaluate, change habits, change things they're doing. And lo and behold, not only do they get better, but then their life becomes more miraculous. And there are a lot of gifts when you go through something, when you have to go beyond and figure out what you can do. Sometimes there's a lot of other things and silver linings that occur.
It's true. It's actually very interesting you say that, because I had one patient who we thought had pancreatic cancer. We weren't sure. We took a biopsy. There's so much inflammation. And sometimes you can't tell. When there's so much inflammation, you can't tell if it's inflammation or cancer. And it was one spot. And we decided we need to remove it because we're so worried there's cancer there that we just don't know. And the only way we're going to know is by removing it, which we did. And the great news was there was no cancer. So all of a sudden, he stopped smoking. He started eating healthy. He lost weight. He reconnected with all the people who meant something to him. And he said the greatest thing that ever happened was for him to think he had cancer. And sometimes when people are diagnosed with cancer or threatened to think they have cancer, they reassess everything. And all of a sudden, the stupid things that we think are so important, that make us crazy, really don't matter. Doesn't matter how long you wait at the traffic light, or how much traffic there might be. It drives me nuts. But the things that really matter in life are the people in your life, the relationship, your friends and your family, having something meaningful to do to make a difference in someone else's life. Gratitude and kindness become the key components that make us feel worthwhile. And unfortunately, when we see an end to our life, when we see our own mortality, sometimes it brings us back to those important attributes. And so, as much as you don't want to ever tell someone that they have cancer, there are patients who will tell me that when they get through it, they not only get through different because of the cancer, but because of an attitude and mindset. And we shouldn't have to have cancer to have that happen. We should be able to recognize what we have. Gratitude, we talked about Thanksgiving. People have studied this. When you feel grateful and you wake up and talk about your gratitude, and I know you do this every morning, and this is in every leadership course I've ever taken, the first thing they tell you to do is write down what you're grateful for, because it puts you in a mindset and it actually makes you more focused, more positive, but most importantly, more healthy. It's a healthier way to live life. But we live in an environment that's always focusing on the negative. Even people have done incredible things. If there's a little something here or there, for some reason that gets focused on, not all the wonderful attributes. And we do it ourselves with people we know. We should try and focus on the positive. Now, of course, there are terrible things that people do, and those things need to be recognized. But there are wonderful things that people do too. And I once made a joke that we should have a good news station, that one channel is just good news, and all the bad news you can watch in every other station. But for one channel, it's good news, so that we could feel hopeful and feel good. And actually, I think that channel probably exists. It's probably the Hallmark station. But I think in real world terms, focusing on the positive and really making sure that we're grateful for the things that make a difference is really the key to not only living healthy, but living in a healthy lifestyle.
I love that. And that's what I
know. I guess that's why we're related.
But they've shown, first of all, being grateful is really an antidote to stress. You can't be in an environment, you can't be stressed when you're in an environment of gratitude. So it's really amazing. And I like to even take it a step further, that during the day, just stop, take appreciation breaks, just stop. Whatever's going well in your life, just take a minute to appreciate. If something's nice, you're outside and it's a beautiful day, or something good has happened, just stop, appreciate, soak it in, because we are wired. I mean, truly, we really are wired for negativity. I mean, if you get 20 compliments and one person says something negative, what are you dwelling on? You're dwelling on the negative. But years ago, we had to be, because there could be a tiger lurking. And it was more important to be aware of that tiger than it was if someone's saying something nice to you. But the good news is we can rewire that. We can rewire that starting today by really focusing on what is working, taking appreciation breaks, and just really soaking it in. When someone gives you that compliment, take 20 seconds to soak it in and really enjoy it.
And the other thing, particularly on Thanksgiving, one of the greatest gifts you can do is give a compliment or give something nice, give some kindness to another person. The hidden benefit of that is that when you give to someone else, even if it's just a compliment, it makes you feel good. And they've looked at this. There's actually a dopamine release when you yourself give an act of kindness. And that's why, gratitude and kindness, they're two sides of the same coin, because not only taking in the gratitude, but being in that mindset that you can provide some level of kindness to another person. And a good example of this is, I work at NYU Langone Medical Center, and Ken Langone is someone who I've gotten to know quite well, who everyone seems to know. And when he walks into the building, Margie, there are people waiting for him. Everybody wants to take him somewhere, escort him. But the first thing he does is he thanks the guy cleaning the floor for keeping the place clean. The next thing he does, he thanks the security guard for keeping us safe. Then he turns his attention to the entourage waiting for him. But when I actually, as you know, I have a radio show. I guess we both like to do this, where we get to interview people who can talk about things that make a difference. But I had Ken Langone on my radio show. I said to him in the last minute, what would you like our listening audience to be left with? And he said, kindness. He says the most important element, to be kind to another human being, not only makes a difference to them, but it will actually improve the world. And I do believe that. And that's where gratitude comes in, and kindness, because it really does make the world a better place. The other piece of it is that we can make this happen. You don't have to wait for it to happen. There are opportunities all around us. We just look past them. We look past the things that people do for us. A simple note, handwritten note to someone who's done something kind for us, who's been a mentor for us. And we look past the fact that a lot of times what we're doing, even in our personal, professional lives, makes such a difference, whether it's raising a child or helping someone in need. In my profession as a physician, how grateful should every physician, every healthcare provider be that we actually can help people when they're most vulnerable. And I just sent out a message to all the gastroenterologists talking about that we often feel burnt out from the work we're doing. This burnout is endemic in the professional world, but how grateful to really recognize that we can make a difference to people when they're sick. And I think by focusing on that, by focusing on what we do and on gratitude, that's really, like you say, the antidote to burnout and disengagement. So it's all good. It just takes an effort to do it. It doesn't come naturally. It doesn't come easily. But when you do it, you feel better because of it.
It's really true. And it's just a mind shift. It's just a different way of thinking, just to stop for a minute and think about all the good that you're doing and what's good. And it makes you feel good. I mean, they even did a study. This is a crazy study where they had college students walk around a building and thinking different thoughts. They didn't even say anything, but every person they passed, they were supposed to wish kind thoughts or good things to that person. And the people that wished the goodness to others actually felt on a scale of happiness, they were much happier. So they actually had changes in themselves because they wished, good thoughts and to other people. So I think any good we can do is just incredible and does make a difference in the world. And I think this is a time that we need that message, because
unfortunately, there's just a lot of things going on and so much bad news when you turn on the news station. So why don't you start the news, Mark? The Pochapin news station.
It's funny because I had been very involved with a lot of media outreach for colon cancer prevention. And I brought this up to people who really do know the media. And they say, Mark, you're a wonderful doctor, but if you create a good news station, nobody's going to watch it. So I don't know. I think we should try. I think we should create, the Mark and Margie good news station. There's so much good news, and there's so many incredible people that do so many wonderful things that you hear about, and they're unsung heroes. So we have to talk about them, and we have to make examples of ourselves. Like when I walk into the garage to get my car, those people are working so hard. I make an effort to make sure I recognize them, call them by their name, talk to them for a minute, make them feel like, they are doing something worthwhile and that they mean something to me. And they do mean something to me. That's the most important thing, that we're all the same. One of the things, Margie, that I talk about quite a bit in medicine, the fact that we all grow old, the fact that we all get ill, the fact that we all die, that mortality is the common thread within the entire planet. It's a global phenomenon. It doesn't matter who you are or what position you are. Nobody can change the fact that we get older and we get sick and we die. And so in the medical profession, it kind of floats above everything else. It floats above politics and nationality. It floats above all of the disagreements that religions may have or countries may have. In fact, it's the universal. And when I am at an international conference, by and large, when we're talking medicine, we're talking the same language. And it's really health and wellness, medicine, illness, treatment is the universal language. It is a common language. And that's what feels so good, to be part of that. And we have to remember that we are all the same. So when I have an endoscope in someone's stomach and I'm looking in their stomach, I can't tell male, female, race, religion, nationality, even age. We are all the same from the inside. And that common bond, we just have to recognize. We all feel the same. We all want the same thing. We want peace. We want comfort. We want to be able to provide for our families. We're able to eat and provide nutrition. But we all kind of are the same. And by recognizing that and treating people like no matter who they are, that they all are important and that we each have to make a difference in each other's lives, by being kind in those acts of kindness and having the gratitude, it really does make a difference. And if it makes a difference for one, like in that starfish story, it makes a difference for all. So I feel so grateful, Margie, to be able to share this. I hope people who are listening recognize how important this actually is. And truthfully, I can do much better. It's not like I'm perfect. I still get upset in traffic, and I have to reframe what it is that I'm getting upset about to try and help so that I really do focus on the things that are important. This is important. What we have as a family, our friends, the people who mean something to us and who we mean something to them. And hopefully people are listening. We can impart a little of what we're saying into their lives so that maybe an act of kindness or gratitude, or if they feel like they're not being given hope in the care of whatever medical ailment they have, they can find that, they can demand it, because there's always hope. And they should always make sure that if they're not getting hope, that they find a place where they can. As long as that hope is realistic, there's always hope. And they should never hear what mom heard, that there's nothing more we can do for you. Those words need to be eradicated from all of medicine, all of everything.
That's just so beautiful. And I think if everyone looked at people, what we have in common, that we have more in common than we have that's different, I think the world would be a different place. And you're right, from a medical point of view, everyone is exactly the same.
We're the same. We're exactly the same. It's and even from DNA standards, we're identical practically. And it's the differences that just make us wonderful. It's celebrating the differences that really is ultimately what makes us better. We just have to change the frame in which we see things, but recognizing and celebrating each of us as an individual, but understanding that we're all of the same mold really can make a big difference.
Right, so some simple things, the takeaways: gratitude, hope, kindness, are life-changing, absolutely life-changing for you and for everybody around you. So in this holiday season, I guess is there any other message that, I mean, you've said so much, but is there anything else that you want to share with everybody?
Other than I'm grateful that you're my sister. I love the fact that you're doing this podcast, and I think it's really wonderful to get these messages out. And, and I just feel very fortunate to be able to be in a position to try and use the knowledge I've learned, not only from my profession, but my patients. My patients have been my greatest teachers, and being able to use their experiences and their wisdom to make me better and impart some wisdom on others is also something I'm very grateful about.
Well, you're very modest because you're the head of a major department, and now in the country, now you are the president of the American College of Gastroenterology. So what's so amazing is that you have this platform and all the other doctors that you can touch with your messages of hope and caring and kindness, because that's what people want. People want to find doctors who give them that message and who treat people that way. And so I think you are doing so much in the world for not only everybody you work with, but all the people that you're involved with. So it's really, as your older sister, it makes me very proud. But for everybody listening, whatever you have, there's always hope. And you bringing this into your life is just going to be life-changing. And if you're dealing with a relative, someone else in your family or a friend, there's always hope. And just remember that and try, because, it can be upsetting in this holiday season, but you can turn it around.
Yeah, and I would say also for people you see who are having a difficult time, reach out to them, write them a note of kindness, or for people who help you, write them a note of appreciation. The 5 seconds it takes to literally write something or send an email makes such a difference, but there's still nothing like just a brief handwritten note of gratitude. It really goes a long way, and we just don't do enough of that. So, the holiday season can be very tough. People have lost loved ones. They might be alone. Reach out to somebody if they're in need. And if you're in need, don't be afraid to reach out to others, because in many ways, by you asking for help, you're giving someone the opportunity to give. And truthfully, I think the ability to give is one of the greatest gifts that you can actually give somebody. And I'm always amazed. People say, I don't want to bother you. It's okay, because if we can help, that helps me too. You're giving me a gift. So I think
that's true. There's nothing that makes you feel better. And I think people don't realize that. They think they're being in imposition. So. Right. All good stuff. Well, we could go on and on for hours on all this greatness, but anyway, I can't thank you enough for sharing all this great wisdom. And
I'm just laughing right now. Could you imagine if Mom and Dad were watching us do this? The two little kids.
Yeah, unfortunately, both of our parents died very young, in their 60s, and so yes, but we know they're looking down. And I guess just to give Mom. Our mother ran the Girl Scouts of Rockland County, and she had this special way of just seeing the best part of each person, looking at each person and seeing what are their strengths and it was really a wonderful role model for both of us in order to look at people and see what's right. What are the gifts that person has? And it's really just a wonderful way to look at the world as well.
Yeah, one of the things that Sherry, my wife, says is that we should always look for the unique genius in people, that everyone does have a unique genius. And sometimes you have to search a little more in some than others, but people have unique brilliance about them. They have talents, and we should always try and look for that. And particularly when you're in a role that allows you to be in charge of others, to be in a leadership role, to really try and find what makes someone unique and special, and really celebrate that, try and help develop that, but most importantly, recognize that when someone does achieve, that it elevates everybody. And I think Mom was really great at that. She really really at a time when women weren't as recognized. Still have plenty of issues, but she really believed in how self-confidence was so important, not just for girls and young women, but for everybody. And that was something that I learned that is so critical, that we have to believe in ourselves before we can believe or help anybody else. So if there's any other message, just to look deep down and think you can do it, not to give up hope, and then ask for help if you need it or give help when needed.
Fantastic. I love all these things. And each one is just so important. And so whatever the listeners take away, each little thing can make a big difference. And as Mark said, when you help one person, you're really saving the whole world. It's really very special. So on this holiday season, wishing all of you, right, Mark? We're wishing everybody lots of love, hope, gratitude, kindness, and just wonderful things for all of you.
Exactly.
So, thank you, Mark, so much for being here.
Thank you. It was great speaking with you, Margie.
Thanks.
Bye-bye.
Bye.
I hope you've enjoyed today's interview with my brother Mark as much as I have, and have taken away some of the valuable life lessons he talked about. Please share this with anyone you think can use a little more hope, because the message is so powerful. In the show notes, I've included some of the organizations that Mark's affiliated with. So, bye for now, and look forward to seeing you next time. Thank you for listening to this episode of the Happy Bones, Happy Life podcast. If you enjoyed this show, please subscribe on your favorite listening app so that you don't miss any amazing insights on upcoming episodes. And until next time, continue to live your best life ever. See you soon.